Well, Assalamu alaikum, Ultrascan Diagnostics. Here, this is the CVCT of the patient that you had requested. The area of interest is the lower anterior teeth. This is the panoramic view. As you can see, the lower anterior teeth have no bone supporting them, and they've been splintered together from the canine to canine. The central incisors and the lateral incisors have no bone support, whereas the canines have minimal bone support. Now, we're going to take you from canine. This is the transaxial view. The transaxial view is basically the proximal view. So we basically have only the lower one third of the tooth covered with bone. The rest, as you can see, is above the crest of the bone. We also have a significant chunk of calculus. We've got the pocket depth is approximately 7.2 millimeters, and here you can very clearly see that you've got a big chunk of calculus on the canine. Now, this is the lateral incisor, and the lateral incisor, as you can very clearly see, there's absolutely no bone available around the lateral incisor. There's pedial widening and periapical radiolucency, and we've got a very big chunk of calculus, which you can see right here. Moving to the central incisor. The central incisor again has zero bone support. As you can see, there's no buccal plate, no lingual plate. It's actually floating. And here also you can see a very significant chunk of calculus on the lingual aspect. Moving to the central incisor on the left hand side, again very similar, no bone support. The lateral incisor again has a major periodontal lesion, which can be seen here on this lesion. We've got calculus here, we've got radiolucency here, zero bone support here. And then we move to the canine on the left hand side, and this canine again has minimal bones. This canine has better bone support than the one on the left. It's almost just below the half of the root structure, and lesser calculus can be seen, and this canine has no radiolucency around it, or any significant pedial widening can be seen. This is the axial view. So the axial view is top to bottom, and you can see the anterior segment of the mandible has absolutely no bone available here. You can see major bone loss in this region, and very significant periodontal disease can be seen here. So we will advise significant bone augmentation, because if you see on this region or on this image, that there is no thickness in the cortical plate either. So the cortical plate below the infected teeth is 3 millimeters only. So significant bone augmentation will be required in order for this area to receive implants in the future. So we will not advise socket grafting. We will not advise just generalized grafting. We will advise that this region requires a bone augmentation using a titanium mesh, so that a significant vertical as well as horizontal bone augmentation can be performed. So if you have any further questions regarding this case, we would be extremely happy to help. One other interesting thing is this rotated premolar. You can see both the roots of this premolar, and this is quite significantly rotated. That this is the transaxial view, where we should be seeing a buccal and a lingual or palatal aspect, but we're actually seeing the mesial aspect here, and we are seeing the distal aspect here. And on the panoramic view, you can see the buccal as well as the palatal aspect of this tooth. Thank you very much.